Welcome to the Beverly Hills Plastic Surgery Podcast. Hello, Dr. Rovelo.
Good evening, Dr. Calvert.
How are you doing?
I'm doing really well. How are you?
I'm doing great, and I am looking forward to our little chit-chat here about brachioplasty.
Otherwise known as arm lifts.
An arm lift, arm tuck,
Yes.
arm skinnying procedure.
Right. It's a well-known surgery because a lot of people really want to have it done. It's amazing how many people want their arms tucked.
But what holds them up? Why do they not do it?
Well, the scar.
The scar.
The scar.
It is the big topic of conversation
Right.
with brachioplasty.
If you're going to talk about it, you got to talk about the scar.
Right, because what it is an incision in order to make an arm skinny. And we see all these, people call them the grandma arms or whatever they want to say.
Yeah.
And
chicken
by the way,
wings.
you can get them when you're young. You don't have to be a grandma to get these. I mean, I've seen 28-year-old women with these, and I've seen a lot of men get them as they get older as well. So this is excess skin beyond the reach of a liposuction procedure.
Right. So by definition, an arm tuck or an arm lift or brachioplasty is a procedure for the skin. It is separate but can be combined with liposuction. So this is not necessarily for patients that just have extra fat on their arms. Sometimes those patients can do okay with just liposuction.
Correct.
And that there's some caveats to that. But an arm tuck or an arm lift is really talking about the extra skin of the arms. The skin that no matter how many tricep dips you do, you're not going to get rid of because the problem is not muscle or fat, it's skin.
Right. And the excess skin is there for many reasons. Some I think it's genetic.
Oh, I think so.
People,
Yeah.
just their grandma had those arms, their mom had those arms, and now they've got them too.
Right.
And then they hate it in a big way.
Well, it's a problem, especially
It's
if
terrible.
you are otherwise normal weight or if you have just a normal body and you have this extra skin or you just carry a bit of extra fat on your upper arms, it makes it hard to fit into certain clothes. You're buying clothes which are bigger than they need to be to fit around your arms. Or it makes you self-conscious about the choices you do wear. You don't wear sleeveless or you don't wear strapless.
Totally.
Because you're really concerned about your arms.
Yeah, and sleeveless is a big deal. Now, you can have a brachioplasty and still do sleeveless because it all depends on where you place the scar.
Oh, no, absolutely. So, okay, let's talk first about the patient that only needs liposuction. Who is that patient?
So that patient does have kind of chunky arms. They're fat arms. There's not a lot of hanging skin.
Or the skin they have is tight.
Right. They have good turgor, good tension on the skin. You can see that by taking away the fat that you're going to get contraction that will not leave you with hanging skin, then needing a brachioplasty, which is never cool.
Not good. So usually that's younger patients that just have extra fat in their skin. And those patients generally do pretty well with liposuction alone. Sometimes the liposuction itself will give a little bit of tightening to the skin and the skin contracts around it and they do great. That is a certain subset of patients.
And I have to mention that I am a luminary for Alma lasers. With the Alma laser, and this is not an ad for the laser or anything, but I've been able to extend the reach of liposuction by treating the skin. And you could do this with whatever kind of, treatment you want, radio frequency or otherwise. If you can suction out the fat and treat the skin simultaneously, that really makes that procedure have a broader reach than previously.
Than just liposuction.
Right.
But even that has its limits.
Sure does.
When you really get into the category of people that have extra skin, then you really are talking about a scar. And I think there's sort of two different classes of people that have the extra skin. I think one class of patients is going to be the massive weight loss patients that have lost a lot of weight and just have excess amounts of skin from their armpit all the way down to their wrist practically. And then there's the more just average patient, maybe a little bit older. Over time, their skin has lost some elasticity and they have the hanging skin, but not to the severity that the massive weight loss patient does.
Well, yeah, and when you say the skin below the forearm, which I've seen, I don't like to make incisions down
absolutely
there.
not.
But like for the upper arm, that chicken wing thing.
Yeah.
This is where
That's where that is. And so once you're in that category, then the question becomes, how do you do it and what can you expect? And this is where the topic of the scar and scar placement comes up.
You can place it in a lot of different spots.
You can place this in a lot of different places. Well, let's talk about that. Where do you put yours?
I like to put mine in the bicipital groove.
Right.
That's my favorite spot.
Yeah.
I like to go right where the biceps meet the triceps and hide it on the inside
of the arm.
Now, when I was coming up through the system, I was taught to put it in the back of the arm so that the patients can't see it, but everybody else can.
Everybody else. I never understood that.
I never understood it.
I
went to a brachioplasty course with a really nice surgeon who's a really good friend of mine who will remain nameless. And I watched him put all the scars on the back of the arms, and I was like,
ew.
You know, and I just thought it's got to be better putting it on the inside of the arm. So when their arm's down,
right.
and you see the back of the arm, you don't see any of that scar.
You don't see it from the front. You don't see it from the back. You don't see it from the side. The only thing I tell my patients is if you're going to wave goodbye to someone, then you'll see the scar. So, yeah, I think that's the most inconspicuous place to put it.
But the scars can be really good. And that's the thing. I think there are two keys. First of all, you got to do the liposuction to empty out the fat out of the arm first to get the skin off of tension. Close it up off tension, make the scar as good as you can, and then there's real value in spray tans. I am like, if you want to have a brachioplasty, get a good spray tan, or you're really going to...
Because the scar is the scar. And how long the scar is depends on how extensive and how severe the extra skin is. Some patients need that scar to go all the way down to the elbow, and some patients can get away with having it maybe go halfway down the arm. And then there's a small subset of patients where you can hide it in the armpit. That's a very small subset of patients. I've had success with like a handful.
Yeah, I haven't loved that at all.
Yeah.
In fact, if anything, I tend to do down to the elbow if I'm doing this operation, and then onto the chest wall with a Z-plasty through the armpit.
Yeah, it always goes through the armpit for me as well.
And a Z-plasty I do just to break up the scar so you don't get banding in the armpit.
Right.
But I think that that's the way to do it, because once you get over on the chest wall, if you're doing a breast lift on a massive weight loss patient, then your inframammary fold scar
just continues
up into the side of the chest wall, which takes care of the bra fat, and then up into the armpit and across to the elbow.
And it's nuts. He's talking about combining it with a breast lift, which has that scar, which goes really under both breasts and that fold. You look at these patients on the table and their arms are out, both arms are out, and you just see this scar going from one elbow down, around, up the armpit, chest wall, across one breast, small little space on the sternum, and then it's just these huge scars. They're huge scars.
But they do okay.
And they
look great.
They get the look that they want,
and
they're
the contour.
Really happy.
Yeah, we don't have a way yet to get that skin to shrink away. We just don't.
No, not without cutting it out.
No, it has to be removed, and that's kind of the bottom line. And so let's go back to the liposuction component with the brachioplasty. I think that the liposuction piece done first, before you take away the skin, really allows the easy undermining and to get
it's key.
The skin to settle where it needs to be.
Yeah.
So you get a great result. And especially, I think it takes tension off the scar. There's a lot of benefits to doing the liposuction with the brachioplasty instead of just lopping out some skin.
Yeah, no, the liposuction is a huge part of it for me. I don't think I've ever done it without it. So I agree. I like the liposuction with the skin excision.
Not sure I've ever lopped off skin either. But I did just say that, so I wanted to come back and
say I actually do not.
I don't do that. Exactly. And then let's talk about aftercare. So we know that the candidates are people that have excess skin, usually with some excess fat. How do you take care of this operation? How much time off do you tell people they need from doing what they do?
I usually say about a week. I do, especially if I'm doing a large incision, I do put drains, and they don't stay very long. I would say maybe a couple days with the drains, and then I take them out. They're going to come off the operating table wrapped up. They're going to look kind of mummyish. Their arm's going to be wrapped in ace wraps. And I would say usually by about a week, patients are feeling okay and ready to go back to work and do activities of daily living, but really no upper arm lifting exercise for a good 6 weeks.
What about arm garments? How long do you have them wear a compression garment?
I really like arm garments. So once they are out of that initial week of swelling, I stop with the ace wraps and I have them put a commercial arm garment on, which just provides compression. And I put them in that for 6 weeks. Yeah.
I tell them to wear as much as they can for 6 to 8 weeks.
Because they're going to swell.
Yeah, they don't have to wear it 100% of the time. They take it off to get in the shower if they got to go out one night. But I like them in it. I think it's very helpful. And they do swell. But they usually look good right away.
No, I agree.
The skin's gone.
Right.
It is definitely a brachioplasty high five at that point because they're so pumped the skin's gone.
And I think one thing to touch on, yes, there are a lot of things we can do to make the scars appear as nice as possible. But I think of all the surgeries that we do, this surgery has the highest wound breakdown rate of all the surgeries. For whatever reason, the arms, this surgery, the skin tends to break down, not uncommonly. And usually it's not a bad breakdown. It's a small little area here or there. But this area is just, it's under tension and forces.
And you're busy.
You use it. So it's not uncommon to see a few areas of just wound breakdown. It's not a big deal. You treat it with some antibiotic lotion or cream and it heals on its own.
Yeah, that's really important to know, but it is understandable. I mean, you're still gonna use your arms. We don't put you in casts.
No.
Bilateral arm cast tends to not be very helpful for activities of daily living.
Yeah, we don't do that in plastic surgery.
No. So, well, that's great. I think we kind of covered it. Anything else with the brachioplasty?
Similar, I think, to the wound breakdown. I think the scars we talked about, you have to be on top of it with the scar treatment.
Yeah,
Again, more than with a lot of the other ones we do. If you're going to form a bad scar in any surgery you have, it would probably be this one. Not saying you will, but it's just a little bit more prone to having thickened scars or hypertrophic scars than other areas of the body. So it's important to stay in contact with your plastic surgeon and just follow their advice in terms of treatments, scar treatments, therapies, etc.
It's always the case with any of these operations. You want to follow up and make sure that you get the best care after surgery.
Agreed.
Well, great. Well, Dr. Rovelo, thank you very much for this discussion on brachioplasty. This is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210. The Beverly Hills Plastic Surgery Podcast is brought to you by Rock Spa. This is MediSpa, located both in Beverly Hills and Newport Beach, providing services such as Botox, fillers, lasers, and all therapy, as well as hydrofacials and all the aesthetic products you could possibly need. It's run by the medical director, me, Dr. J. Calvert. Rock Spa Beverly Hills is located at 120 South Spalding Drive in Suite 340, Beverly Hills, 90212. The phone number there is 310-777-0496. And Rock Spa Newport Beach is located at 1617 West Cliff Drive, Newport Beach, California, 92660. The phone number there is 949-644-1111. You can go to their respective websites, rockspanewportbeach.com or rockspabeverlyhills.com. Rock Spa was created to help my patients maintain their aesthetic beauty in between whatever operations they have throughout their lives. It's something that allows patients to come in, get their facials, skin treatments, take care of all the Botox fillers and lasers that they need to keep up their beauty. And if they've invested in any of the aesthetic operations I perform, it's the way to maintain those operations. If you mention this podcast, you will get the members' pricing for your hydrofacial. The Beverly Hills Plastic Surgery Podcast is the way that Dr. Rovelo and I talk about the issues that are important to us in plastic surgery. But there's nothing better than getting to take care of our patients and do plastic surgery. Our practices are located in Beverly Hills, and I also have a satellite office in Newport Beach. You can learn about my practice at drcalvert.com, and you can reach my office by calling 310-777-8800, and that will get you an appointment either in Beverly Hills or at the Newport Beach office.
My practice is located in Beverly Hills. Our office phone number is 310-954-1355. You can also contact us directly through the website, which is roveloplasticsurgery.com.
We look forward to seeing you in the office for some aesthetic tune-ups.